Well, Dr. Young, thanks for joining me today. It's
My
a pleasure
pleasure.
having you on our monthly video blog. Um, but I wanted to have you on today really to talk about the legislative efforts of the Maryland Psychiatric Society. Remind me, how long have you been the co-chair of the legislative committee?
This is my third year as
Third year. Okay. Tell me why you decided to become one of the co-chairs and I guess what is it offered for you in terms of your own professional growth?
yeah, thanks for asking. So, my first toe in the water with a committee on MPS was the legislative committee. So, I initially just started showing up to meetings early on in my career and observing and just seeing how my colleagues and more experienced colleagues uh, discussed these different pieces of legislation. And I just really thought it was fascinating seeing people from all fields within psychiatry, forensics, child adolescent, uh, policy. It was an exposure to me to the broader field in a way that I just really found interesting. And each year I participated, I became a little more familiar with the language, a little more interested in the topics, and a little more able to participate in the discussion. So, as I just found a natural interest in this, I kept on leaning in to participating a little more and was invited to join as a co-chair with our true legislative guru, Ann Hansen, which was a great experience. And I've learned so much from people like yourself and Ann and others that have been on the committee for a long time. So it's really been a fantastic addition to the volunteer aspect of my career. And it's more and more fun each year as I'm a little more familiar with the process.
Yeah, all of a sudden you become one of the wise ones that other people are learning from, huh?
A little bit.
Well, tell us a little bit about this year. I'm on the legislative committee too, but for those who are watching this, maybe some key pieces of legislation that have come up this year that you think have been most interesting or might be most impactful.
Yeah, absolutely. And we just had our opportunity last week to advocate for some of our priority legislation with the Maryland General Assembly. The members of MPS, members of the Legislative Committee, got together in Annapolis last week, and we met with over 30 different members of the Maryland General Assembly to advocate for our priorities, which was a really great experience. And so I'll comment on a couple of those things now. So, in reviewing the legislation that affects psychiatry this year, 2026, we've lend our support toward 18 different pieces of legislation. I'll highlight a couple of them here that we're strongly in support of. One is the surrender of firearms part of the AOT bill, assisted outpatient treatment, which is the outpatient involuntary commitment. Uh, we acknowledged and wanted to correct the fact that firearms were not restricted from this population of severely mentally ill folks that are mandated to outpatient treatment. So we've been strongly advocating as probably our number one piece of legislation getting firearms restricted for that population. So there was a lot of support with the members of the General Assembly that we met with. So hopefully that will be successful this year. We also advocated for Maryland medical assistance and other insurance programs to be mandated to to cover mobile crisis and crisis stabilization services to just really bolster the safety net mental health services for the state. Another really interesting piece of legislation this year that we were comfortable with and advocated for was correctional services medication review committees. So this is essentially being able to med panel people that are incarcerated through a similar mechanism as people in state hospitals and the hospitals where the inpatient hospitals we're familiar with. So I think that'll be a real boost to the ability to treat people with severe mental illness in the correctional setting.
Yeah,
We're
that's real interesting one that about people that are actually, I guess, in the asylum sections of prisons who, are so very ill that they are refusing treatment, but maybe not quite enough ill to go to the state hospital, or maybe there's not a bed in the state hospital. So I think it's a really creative solution to treating those folks who are clearly in very much in need of care.
Yeah, absolutely. And we wanted to be very careful to make sure that the same rights that people outside of the correctional setting have are maintained within that setting. So it's a good balance of being able to care for severely mentally ill people while also protecting their rights.
Right.
One more I'll just comment on is petitions for emergency evaluation. We advocated in favor of being able to extend the window that the emergency petitions can be acted upon by the police. And the thing that we liked about this piece of legislation was there's a judge involved. And so in 5-day increments, emergency petitions can be kind of reinstated by the judge so that people that the police are having difficulty locating can be located and emergency petitioned, even extended beyond the current limitations on that. So on looking at the specific legislation, we thought that was a good idea. So we're advocating for that as well.
Yeah, that's a good one. I actually spoke at one of the committee meetings on that one. It seemed to be well received. So I'm hoping that that moves forward as we know how tricky it can be regarding the emergency petition process.
Definitely.
Let's talk about opposition. You covered a lot of the good ones that we're supporting. I know that there is a key piece of legislation that we're opposing this year, and that's regarding psychologists prescriptive authority. So tell us a little bit about that piece of legislation and what arguments we're making against it.
Yeah, so this is for licensed psychologists to gain the authorization to prescribe medications. While there's a group of psychologists that are advocating for this to be able to prescribe, American Medical Association, American Psychiatric Association, and MPS are all in alignment that psychologists really don't have the requisite background training in medicine and clinical work to be able to safely prescribe. So the APA has done a tremendous amount of advocacy in various places, various states over the years to keep psychologists prescribing at bay. And they were able to share with us some of the work that they've done and some of the key arguments so that we can kind of really understand the full picture. But essentially, it comes down to psychologists, although excellent colleagues, very valuable within the field. We enjoy as psychiatrists collaborating with psychologists effectively to bring comprehensive care to our patients. We do think that it's important for each member of an interdisciplinary treatment team to have the requisite training to do that safely. So psychiatrists, as everyone in MPS knows, have years of basic sciences training, medical education, not only medical school, but a 4-year residency program with many, many clinical hours and didactics and experience with patients in various different settings and across diagnoses. We learn how medications can affect all systems of the body, cardiovascular, metabolic, the kidneys, the liver, drug-drug interactions, pharmacokinetics, pharmacodynamics. We learn all of this in practice over time under mentorship and clinical experience. Psychologists have none of that. So the proposal is for them to take some psychopharmacology courses, had a crash course in psychopharmacology, and then be able to gain prescriptive authority. Clearly, that is not safe for patients when you talk about people that just aren't trained in general medical care, the different organ systems of the body, and are not going to be able to understand complex drug-drug interactions and the overall effects. So we really are just advocating for safe care of our patients and for other ways to expand access to care, which is also at the heart of our priorities. So things like collaborative care model, expanding telehealth, these are like things that can actually extend access to care in the community. In previous studies that have been done of psychologists prescribing in the very few jurisdictions where it is allowed, it has not been shown to significantly increase access to care. Now, psychologists practice in the same place as psychiatrists do, rather than rural areas largely, and it just does not have that significant impact. So really, the thing that it would be intended to do, and we granted that it's a well-intended piece of legislation to increase access to care. What has been shown through the studies of this is that it really doesn't impact access to care much, and we definitely think it would impact quality of care in a negative way. So we're very adamantly against that, which is in line with APA, other state psychiatric societies, and even the American Medical Association and MedChi are opposed to this.
Yeah, yeah. Well, thanks for that overview. I know that you have been working really hard along with Cynthia Lewis, Major Lewis, your co-chair, in sort of a stepwise progression in terms of how to work against this bill, including doing a lot of pre-work even before the bill dropped, and doing some preliminary committee meetings and meeting with liaisons from APA, MedChi. So I just want to thank you for all the hard work you've done, sort of mounting it. Effort to oppose this bill because I know that all those things you have to fit in the wee hours in between work and kids and your own health. So thanks for really just volunteering and putting in all this effort, especially during this really busy time.
Yeah, no, absolutely. And thanks for this opportunity to talk about the legislative committee, and just use this forum to just invite as many MPS members that are interested to join us. It's really a lot of fun. You learn a lot about psychiatry. You learn a lot about the field of psychiatry just by working with different colleagues across different treatment settings and different areas of expertise and fellowships, and it just really enriches the professional identity to be part of something like this, as well as just what an important part of the identity of a physician, for advocacy for our patients and profession. So it's really fun, it's really interesting, and it's really enriching. And so I just encourage anyone to reach out to me directly, and I'm sure you'd extend the same invitation, Dr. Means, to get involved in the legislative committee.
Awesome. Well, thank you so much. On that note, I think I'll let you go. Thanks for doing this and educating us all on the benefits and hopefully the impact of the Legislative Committee of the Maryland Psychiatric Society.
Absolutely. Thank you.
All right, take care.